Coach Tess from HealthEversity, and today we are going to be identify some common terms in E&M for the CPC board exam. So for the last couple of videos, I've been showing you my highlighters. I'm using the pink today. Pink. All right. There are no procedures here. For E&M is all about the doctor's visit. Where are they doing their procedures? Where they are doing their services? Okay. So these are some of these terms that you might see in your questions and common terms that will help you. Okay, this is a very brief video and very easy to identify terms, and we're just going to go through them. Where do I get this from? This is a AAPC book for students, and the easiest one to identify is your AAPC study guide. Okay, look at the back of the book of the AAPC study guide where you have the glossary, and this will help you go through all of the videos, and then it comes in alphabetical order. Okay, so these are some of the terms. Go up there, try and identify and put them in sections. So what I did, use this book to help you to separate your glossary. Okay, so here we are, and we are going to jump right in. This is very short. Okay, all right. So some of them you might see. Okay, some of them you will see. A lot of these terms you will see when the doctor is writing the chart. Some of them is just terminology that we use. Okay, so see, chief complaint, the reason for the patient presence for an encounter, why they go to the doctor. So on the chart they might put CC, or they might put chief complaint, where they go to the doctor for. I went there for shortness of breath, SOB. Okay, counseling, you'll see that in a lot of your evaluation and management codes. You will see why they went there. The doctor had to counsel them on certain things, so on. So critical care, oh wow, this is one of those things that you're going to see a lot on the board exam in this section. Okay, you get a lot of practice questions on this. We have a series coming out with a lot of practice questions, so this will help you. Okay, established patient. So you have new patient versus established patient. So you need to know the difference between an established patient, how long they've been seeing the doctor, within 3 years or before 3 years, all that good stuff with their established patient. Okay, family history. Did your mother have cancer? Did your father have diabetes? What type of genetic issues that you've been having? What is going on with your family? You could possibly have something. So the family history comes in. History of present illness, right, is a chronicle disorder. So history of present illness, right? So I use my highlighter right here to kind of give me what is the most important terms or most common term that you might see on the board exam. Not that all the terms are not important. Okay, so history of present illness, HPI. So that's very important. What the doctor, they might say 70-year-old patient presents for shortness of breath, vomiting, diarrhea, and they came from a transfer from a hospital. So they're basically giving you what is happening with the patient when they've first seen the doctor, and what he's basically telling you about what's going on with the patient. History of present illness, along with when you come up with your codes and all that stuff. But when the insurance company, that's what they read. That's one of the most important things on that summary they look for, is to make their determination if the coder coded right, or whatever they deal, if the cost is right, and they make their determination whether they're going to pay it or they're not paying it. So your HPI is one of the most important things. You could run all the tests you want. This is this is like the most important term, in my opinion, Coach Tess' opinion, for working in the insurance industry, health insurance industry, working in these different doctors' offices and stuff like that. Very important. History of present illness. Okay. All right, new patient. So you have your established patient up here, and now you have your new patient up here, down here. All right, medical necessity. You have necessary and you have necessity. So you need to know the difference between necessity versus necessary. I get my words tied up, but you understand. Okay. Observation status. When they go into the emergency room and they put them in observation status, very important. Okay, so you need to know all of those things. All right, palpitation, touching the body when the doctor is doing his examination. All right, percussion, sounds from the body tapping, and review of systems. So these are some of those terms that you'll see on the CPC board exam. There's a lot more, but those are pretty much self-explanatory. So AAPC, if they are the writers of the test and they're telling you to check out these terms, it must be for a reason. Don't take it for granted that, I'm not going to do it because it's too much. No, if the board exam is telling you something, pay attention to these, okay? AAPC is telling you this is AAPC content, okay? So, guess what? Talk to you next time.